I would like to welcome Kalpana ma'am to introduce our final speaker of the day.
It is a great honor to welcome our distinguished guest speaker, Dr. Manu Arun, a renowned pediatrician. Dr. Manu Arun is a renowned expert in her field, boasting an impressive educational background that includes gold medal in MD Pediatrics from SRMC Chennai, certificate program in child and adolescent mental health in NIMHAS Bangalore, held in 2006, diploma in Montessori and child education, Bharat Sevak Samaj, diploma in remedial education from Madras Dyslexia Association, certified motor skills training coach from Motor Skill Learning Academy, Switzerland, certificate program in verbal behavior therapy for professionalism from Dr. Mary Barbara, USA, Dr. Manu Arun, a highly respected and accomplished pediatrician with a strong background in pediatric practice, which includes general pediatric practice in Sri Narayana Child Clinic, Vadapayani since 2007, Director of Dr. Manu Child Development Center, Vadapayani and Nungambakam, Director of Dr. Manu Foundation Montessori Nursery Inclusive School, Nungambakam since 2011. Director, Empower Inclusive Sports Academy, Vadapani and Nungambakam since 2020. Director of the Learning Bridge School Inclusion Service, launched in July 2024. Dr. Manu Arun currently serves as a Joint Secretary of Tamil Nadu Play Schools Association for Child Development, Health and Safety. She is also an executive board member of Chennai Play School Owners Association and Tamil Nadu's Women Entrepreneurship Council, where she provides an exceptional leadership and expertise in pediatric care. She is a proud winner of the Best Inclusive Preschool in Tamil Nadu 2024 from the American Accreditation Council. Authored the insightful book, which provides a step-by-step guide to introduce solids to babies, which is available on Amazon Kindle. Dr. Arun is dedicated to delivering personalized family-centered care that addresses the unique needs of each children. Her warm and compassionate approach has earned her a reputation as a beloved and respected pediatrician in the community. Please join me in welcoming Dr. Manu Arun as she shares her insights and expertise with her in today's topic of identification of developmental disorders that inhibit learning and ways to tackle them. Welcome you, Doctor.
Thank you, ma'am, for the very grand introduction. Overwhelming introduction. Thank you. So, since I'm the last speaker, I'm a little scared now. Are you all listening? I can see the left side is heavy, the right side is light. Should we balance it out? Some people from the back, would you like to come and sit on the right? Here? Ma'am, can I also have the rotating mic? The PPT? So have we balanced it out? I think why there are 2 rows which are empty here. Would you like to come forward? The last rows. Yeah. Have these papers been distributed, ma'am? Have you received a handout? Yeah. Handouts. You have to give it to them. I have been introduced to you. I'd like to be introduced to you. Can you all introduce yourselves? So I got to know that there are 10 institutions here. Can one of you tell me from which institutions you're here? Balavihar is working with children with special needs exclusively. Okay. Student. Second years. Okay. Then? Handicapped children. Only hearing impact. Okay. Sankalp. Deccan. You're dealing with what kind of children, ma'am? Learning disability. Okay. Then? Others? Only 3 institutions are here? You people? Rest of you also belong to the same 3?
Dr.MGR Home and Higher Secondary Institution, Education Institute, first year and second year students. Hearing impaired.
Hearing impaired. So there are students dealing with with the developmental disabilities with hearing impaired. Okay. And you're going through your first and second years. Okay. So my topic for today is how to identify children with special needs. So how do I? Okay. So this seminar is when children are brought to you, or you are coming across children in a regular setup or in your hearing impaired setup, looking for developmental disorders which are not associated with physical disabilities. Okay. So physical disabilities are hearing impairment and visual impairment. இது காடிய வேண்டாம். ஓ இது வீடியோ தான் ப்ளே ஆகுதா? அப்ப ஸ்டாப் பண்ணி. Oh, in the pause. Okay. Sure. I got it. Okay. இல்ல இல்ல. So what I'm going to do today is help you to identify the special needs in a classroom. Okay. And help you to confirm to the parents. See, if somebody is coming to you and they have a doubt, some parent is suspecting and they want you to help them out to confirm, is my child? And because bringing to a special school is a very difficult decision for the parent to make. So this is for you to use at your entry point, so that you can tell them, yes, your child has these issues. So the child falls into these criteria. So this is your child's diagnosis. So kindly accept it. Okay. So if I have a problem and I have to accept it, I need some visual reinforcement, right? I need a blood test or an MRI or something like that, mainly because today we have a lot of developmental disorders which do not have physical evidence, like blood tests or genetic tests or anything that you can give in a printed format. So we are going to use this as a tool. Okay. So all of you have been given out a handout. Okay. And in that handout, I have just, first I will introduce you to the ages and stages questionnaire. Okay. Can you take that page where it's written ages and stages questionnaire? Okay. This is the ages and stages questionnaire. Okay. This is freely available online. You can just type it out. Ages and stages questionnaire. Okay. So this questionnaire has 21 questionnaires. Okay. Which will start with 2-month-old. Okay. And go on up to 6 years. Okay. So every 2 months you have a questionnaire. And say your child, you've been brought a child who is around 15 months. Okay. Then you don't have a questionnaire for 15 months. So you take the previous questionnaire. Okay. So you take the 12-month questionnaire. All right. It's very simple. It's easily, you can mark it. You can hand it over to the parent and ask them to do it, or help them out with it. Okay. And then from 27 months, it's 3 months apart. And from 42 months, it's 6 months apart. I have taken the 36th month questionnaire for you today, because mostly children will come to school by 3 years. Okay. And I'm going to give you a scenario where you can try to mark. It's marked for you, so it'll be easier for you to follow. So please pick up that paper and see the first page. Okay. In that you'll have the common data. Okay, you'll have the common data, that is the child's information. Okay, the name, the date of birth, okay, and the first name, middle name, all those things, address and all those things. That is the first page. Okay, and this questionnaire has different domains. Okay, do you know what are domains? Just so I can, yeah, what are the domains in development? Okay, very good. Just like ma'am's session, I can see the left side is still more awake than the right side. Come on. Okay. So, communication and language, motor skills, then social, okay, social, emotional, okay, and in motor skills, you have two domains. Okay. Gross motor and fine motor. Okay. So, we are going to assess for each child age-wise, what is the, has the child achieved that? Okay. So, that's the first step. So, when a child is brought to you and you have to understand whether this child really needs a special school, because I'm running an inclusive school and sometimes parents come to me saying that from this special school I'm coming, ma'am, and the teachers there are saying that my child is not as bad as the others and I don't have to put my child in a special school. Okay, sometimes it will be a wrong thing to do that, because if a child is having special needs, though inclusive schools are available, okay, in a special school you will get very special attention, right, and tailor made IEPs, curriculum. Okay, so I would say if you really feel your child has become age appropriate and can manage in a regular classroom, only then you should transfer, because early transfers, they are first accepting to come to special school is very difficult. After they accept and come there, confusing them, okay, that's going to take going back there is going to be difficult. Okay, so first taking a child in and discharging, in both places you have to assess whether the child is within the developmental parameters. So this is the first page, contains about communication. Okay, so the question, I'm going to read it out. Okay, when you ask your child to point to her nose, eyes, hair, feet, ears, does she correctly point to at least 7 body parts? This is for the 36-month old. Okay, and here we are giving a response. He or she sometimes points to nose, eyes, hair, feet, ears. Okay, there are 3 columns. Yes, sometimes, not yet. Okay, so in this, according to the history that I have given, you take it at sometimes. Okay, so sometimes gets 5 marks. Okay, and yes gets 10 marks. All right, not yet gets 0 marks. So this is the general outline. You go through the questionnaire, you go online. I will ask them to share the link with you. It's a really big fat thing, so can't print it and give it to you. Which age you are generally having children admissions in your school, that age alone you print and keep with you. Okay, so this is very easy. In each domain you have questions and accordingly you can mark. Okay, the example that I have taken, okay, communication and social and emotional. Okay, so the second domain, next page is gross motor. Okay, then we have fine motor, problem solving. Okay, so in the example that I have taken, gross motor and fine motor are getting above 30 marks. Okay, they are getting 40-45 marks. All right, but communication and problem solving is coming to 10 or 15 marks. Okay, so I'm presenting to you now the commonest developmental disability. I hope all of you are aware of that, autism. Okay, and autism can also coexist with hearing impairment. Okay, hearing impairment is both a differential diagnosis of autism and it is a comorbidity of autism. It can be exist along with autism, or it can actually be hearing impairment can be misdiagnosed as autism. autism can be misdiagnosed as hearing impairment. Okay, so the rule that we have been taught as development pediatricians is when a child is brought to you saying that the child is not making eye contact, the child is not speaking appropriate for age, first before going to these subjective analysis, you go for a proper hearing assessment. Okay, a proper BERA, which you can do and rule out hearing impairment. Today, all newborns are screened on the 3rd day of life for hearing impairment. Because I had a child, they told me that they've already done the BERA in Ramsara Medical College, and they said it was normal. And for a whole year, I had the child in my school trying to do inclusion. The child did not show any improvement. And then I started watching that when I'm sitting with him, he's looking at my mouth. Okay, and he's really trying to listen to me. And then came the second child, the same family, with similar complaints. So when I had the repetition is now, we are seeing repetition in autism. But at that point of time, 5 or 6 years ago, we did not see much repetition in autism. We can see repetition and hearing impairment in the same family, next sibling also having a thing. So I insisted that they bring the hearing test report that they had done in Ramchandra, which they had claimed to have done. And only then I discovered that it's clearly given the child did not pass the hearing test and the child was recommended a hearing aid. Okay, but what the audiologist has told is, I'm going to give you a trial of 3 months. Okay, I'm going to give a trial of, he has written trial of 3 months. So the trial of 3 months is trial for hearing aid. Okay, but what the parent interpreted as trial, go and try in a school or give speech therapy, okay, and try to engage the child for 3 months. Still, if the child does not respond, then we'll go for another test, something like that. They have missed it. Okay, but what the audiologist has written in the report is the child has hearing impairment, and we are going to give a trial of hearing aid for 3 months, followed by speech therapy. Can you understand? So the parents will get very confused. They will listen to half the things. They will tell you half the story. They will not tell you the rest of it. Okay. So we have to take the report and see. Have they done a hearing test before we put them into the slot of autism? Okay. And children with hearing impairment, okay, and autism have very similar features. Okay. So what happens is sometimes if a hearing impaired child has autism, you might not come to know. And it's very difficult for the parent to accept a diagnosis of hearing impairment because gross motor and fine motor skills will be appropriate. Physically, there will not be any challenge. Okay, so this questionnaire, in the last page, if you see, there is a page where you have a graph. Okay, and in this graph, okay, this graph, you have a color coding where there is a black area and a gray area. Okay, and in the scenario that I have given, okay, I have marked, it's going to come up, in which the black area, in that communication, problem solving and personal social is coming into the black area, and the gross motor and the fine motor skills. Stop it. So this is the page. Okay, can you see? For those who did not have the questionnaire, so this is the page of the questionnaire. So this is communication. Okay. This is gross motor. Okay. Fine motor, problem solving. If you see, you can see fine motor is 45, problem solving is 25. Okay. So when you point to the figure and ask your child, he is not able to tell whether it is a boy or a girl. Personal social, again 25. So this is the page where you will get your diagnosis. So if you see this page, you can see that in the communication, problem solving, and in the personal social area, our child, which we are going to discuss, which we are discussing today, has got mark. And in the gross motor, fine motor, the score is 45 and 50, which is coming in the white area. Okay. So such a picture is very common in autism. Okay. Where gross motor, fine motor skills are normal, but social and language and problem solving is delay. Okay, you got that take home message? Okay, so you go home, print this out, and you try to administer this in some children, then you will get very easy with it. With this, your first step of convincing the parent, see your child is having some delay. Okay, one more thing I'd like to say is, any bad news is difficult to take. So when a parent is told that your child is having a problem, okay, they might find it difficult to take diagnosis. Autism is a very difficult diagnosis. So what you can tell is, your child is having certain delays. The child is having speech delay, problem solving, and personal social domains. Your child is having delay. So we'll have to work on that. Okay, you're saying the same thing. Okay, you're saying what to say. Instead of saying apple, you're saying apple. Okay, but for a parent to hear the word autism, it might be difficult. So you can tell them, your குறைபாடு அப்படின்னு சொல்றதுக்கு பதிலா குறை நிறை. ஓகே, ஸோ குறை அப்படின்னு சொல்லும்போது நீங்க நிறையும் சொல்லிட்டீங்கன்னா, அப்போ இன்னும் கொஞ்சம் கன்வின்ஸ்ட் ஆயிருப்போம். இல்ல டாக்டர் இதெல்லாம் நல்லா பண்றானே, அதெல்லாம் நல்லா பண்றானேன்னு அவங்க வாதாட பார்ப்பாங்க. அப்போ நீங்க வந்து உங்க குழந்தைகிட்ட நிறைய நிறைகள் இருக்கு, அதை வந்து நம்ம இன்னும் பெட்டர் பண்ணி கொடுக்கலாம், இந்த குறைகளை மட்டும் சரி பண்ணிக்கலாம். ஓகே, இப்போ நீங்க ஸ்பெஷல் ஸ்கூலுக்கு வந்தா, ஓகே, இன்னொரு காமன் கம்ப்ளைண்ட், ஸ்பெஷல் இன்னைக்கு காலையில கூட ஐ ஹேட் அ கால். என் குழந்தைய நான் ஸ்பெஷல் ஸ்கூல் கூட்டிட்டு போனேன் மேடம், அங்க வந்து மற்ற குழந்தைங்களை பார்த்து அவங்க இமிடேஷன்ஸ் பண்றாங்க. ஓகே, இதுக்கு நீங்க என்ன சொல்ல விரும்புறீங்க? Teachers who are working in special schools, what can we do about this problem where children are learning bad behaviors from other children? What do you say from this side? Have you faced this? They are copying from the other children. Okay, that is a complaint from parents. Ipo there are children who are shouting, who are flapping their hands, who are spitting, who are beating the other children, and my child does not have those habits. Yes, my child is autistic, but if I put my child along with that child, this child is going to learn from that child. Okay, so that's why I don't want to put my child in a special school. Okay, this is what the parents are saying. So what do you think we can say about that? Yes, very good. Okay, even typically growing children have bad behaviors, correct? And inclusive school also, they can learn bad behaviors. Okay, leave out inclusive school. Okay, non-inclusive school, in a school where we believe that all the children are typical, still they can learn bad words, bad behavior, correct? And I want to tell you one more thing, behavior is not all learned from others. Do you agree with me? Okay, for example, masturbation. Okay, do you think everybody is being taught to masturbate? Okay, leave out that. Okay, sensitive topic. Digging your nose. Okay, or digging ears, or scratching the head. Can you understand? Or repetitive scratching. Do you think somebody will teach you how to do that? Okay, all of us have certain obsessions, right? Or we have certain pleasures. Okay, like some people keep on pulling out their scalp, correct? Even adults do that, correct? Do you think all behaviors are just coming from imitation? No. Okay, so that is the point you have to break. You have to tell the parent that you have to understand that every human being is evolving. Okay, evolving from the inside. Okay, when your child becomes an adolescent and when there are hormonal changes, the child is going to feel certain things, and the child automatically places his hand in his private parts. Okay, nobody is going to teach him that. He doesn't have to see. You lock him up in a room and keep him in the dark for 24 hours for 10 years, he's still going to develop certain habits. Can you understand what I'm saying? So you'll have to drive this into the children, into the parents whom you are dealing with. Okay, when you're dealing with bad behaviors, did my child learn this from your school? No. Okay, all of us have certain instincts. Okay, we want to express our frustrations, okay, or our ideas or our excitement, and we use certain gestures. Can you understand? And we use certain ways to express it. Okay, we shout. Okay, we can spit. Okay, we can say chi. Okay, all these things nobody teaches us. We don't see it from somebody. We learned it from the mother. We learned it from my father. My party uses this. No, nobody uses it. Still, you can do the same. Can you understand what I'm saying? So, along with diagnosis, okay, there is something called what Madam said, pairing, right? Pairing. So, if you are going to trust me, okay, then you might accept what I tell. Okay, so that pairing has not only to be done on the first day, but it has to be done consistently. So, along with the first diagnosis, I'd also like to tell you, keep reinforcing, keep redoing the assessments to show them the progress. Okay, so you can use the same tool, okay, and say 3 months later or 6 months later, even for your hearing impaired students, you can use this tool and show the progress. Okay, so progress might not always be academic. Okay, they might just improve in their sitting tolerance, they might just improve in their listening skills. Okay, they might just improve in the way they look at you more often. Okay, so those things also should be registered and conveyed to the parent. Okay, so along with diagnosis, please think about reassessments. Okay, reviews which are standardized, so you can put it across to the parents, and keep pairing with the parent and keep telling them ahead. Okay, so before a problem arises, before they come to you saying that my child learned this from your school, before that itself you talk to them telling that these things happen at this age. Okay, so orienting the parent to what can happen. Okay, so this is not only because of the special school, these things will happen, but here we keep watching. Some behavior is coming up, or if you notice a behavior, you can share it with us. We will start working on it. Both of us, parent and teachers, will work on it, and we will try to get the child out of that particular behavior. Okay, and when you get rid of that behavior, there is going to be another behavior. Okay, because every human being needs pleasures. Okay, but you'll have to settle down for something that is socially acceptable. Okay, so if you feel that digging the nose is a bad behavior, it's socially not acceptable, okay, then maybe fidgeting. You can give fidget toys. You can give a sensory area where you can, so in the classroom you feel the child is going on rocking, okay, and it is disturbing your class. Okay, you don't want that to happen. Okay, that is disturbing your class. Then you replace that rocking behavior with maybe something which can be silent under the table, which the child can keep on fidgeting. Can you understand? So we have these stress bands, therapy bands, therabands, which you can put on the table, no, where the child can put the leg and they can keep pushing on it. Can you understand what I'm saying? Okay, look up therabands. Okay, so like that, you have to give them some fidgeting opportunity where the child can continue their behavior without disrupting the class. Okay, so the next assessment tool which I'd like to take up is, so this is roughly all the different uh, syndromes and problems that you can come across. Do you have an experience with Down syndrome? Anybody? Yeah. So even in Down syndrome, you can have hearing impairment. Yeah, or a visual impairment. Okay, but Down syndrome children are actually very sweet. Okay, they are very helping. Okay, only problem is their tone is less and their IQ will be less. Okay, but they'll be they can be groomed into being helpers. They can help the other child. You can see naturally they have a tendency to be a partner, a buddy, where they can help another child to come. A physically disabled child, they can help. That way they get very motivated. Okay. Now next, there is another paper called Vanderbilt ADHD Teacher Training, Teacher Rating Scale. Okay. So for those who cannot, do not have the paper, this Vanderbilt is completely, I'm going to show it on the screen. Okay. So you see that, okay, in this Vanderbilt ADHD diagnostic teacher rating scale, you can diagnose ADHD, attention deficit hyperactivity disorder, which again coexists a lot with hearing impairment, okay, with visual impairment. All right. So that ADHD can be just inattention without hyperactivity. It can be hyperactivity without inattention, or it can just be a combined type ADHD. Okay. The last two are more often found in even typical children, oppositional defiant and conduct disorders. Okay, that is சொன்னபடி கேட்கறது இல்ல, அடம் பிடிக்கிறது, oppositional defiant, and then anxiety or depression. So this is a teacher rating scale which you can use. This is also freely available. Okay, so for this you have to look through the so the first 1 to 9 questions in this scale, okay, will, out of which 6 is positive, means then attention. So I'm going to stop this here. So fails to give attention to details in schoolwork. All of you can read the board? Yeah. Has difficulty sustaining attention in tasks. You ask the child to write A to Z. The child is writing A to H and then starts talking or asking questions. Okay. Then does not seem to listen when spoken to directly, does not follow through an instruction, and does not finish schoolwork, has difficulty organizing tasks. Okay. So does not put back everything into the bag, things like that. Avoids, dislikes, or is reluctant to engage in tasks that require sustaining mental effort. Small things you give the child. Okay, you give a child the 4-piece puzzle, the child is able to do. You give them a 10-piece puzzle, they're finding it difficult. Okay, so and then loses things very often, is easily distracted by any external stimuli. Somebody is walking, the child immediately looks outside. Okay, and is forgetful in daily activities. So out of these 9, okay, if your child is getting 6, okay, so you have 0, 1, 2, 3 marks, okay, according to the level of the particular symptom. If your child is getting a score of 6, then it is inattention. Okay, after you diagnose, what can you do for inattention? Any ideas? How can we handle inattention? How do we improve attention? Making it more interesting. Okay, and you have to make it smaller, the task smaller. Ma'am said about task analysis, no? So making the tasks smaller. So if you're giving a chapter, or say for example a homework, and the child is not completing the homework, okay, so you're asking the child to write from A, B, C, D, 4 alphabets. You're asking the child to write at home 5 times and come. Okay, and the child is not writing. Okay, the child is bringing the work incomplete. Then you make it smaller. Okay, and you divide it into, say, over a week, or you tell the parent, make it into 4 different slots. Okay, make the child write A, take a break, then write B, take a break. Okay, with reinforcements. Okay, so inattention is something that happens when you're networking. Okay, we have a sensory network. Okay, our eyes, ears, nose, tongue, and skin are sensory organs. Okay, so these are the 5 senses we all know. Okay, there are 2 very important senses which are very essential for special educators. What are they? Yes, can you explain to me what is vestibular? Vestibular sense is the sense of understanding balance. The sense of, so if I'm standing here, I have to understand the leveling of the floor. Okay, say if there are something in the middle here, the wire is going in the middle, means I should understand that the wire is there, so I should put my leg up and go like this. Okay, so this is a sense of the balance and movement. Okay, so around me, the level of the ground. Okay, my relationship with the ground. Okay, only if I know that, I can stand in one place and do the rest of whatever I'm doing. Okay, so this sense is again picked up in the ear, in the cochlea. Okay, so again with people with hearing impairment, they can have problems with balance and coordination. Okay, so you have to teach them how to sense the different balances. So for children with inattention, it's very important that you give them a lot of physical activities. the physical activities which will give them different perceptions of balance. Okay, so that's why you go for occupational therapy, make them jump on a ball, climb on the obstacle courses, monkey bar, okay, and walk on a balance board. Okay, these things will help the child to feel the surrounding the ground and improve their attention because they are networking. Okay, so the sensing organ inside the ear has to send a signal to the brain. The brain has to pick up the previous memories. Okay, so I have climbed a table and switched on the change the bulb. Okay, so if I've had that experience and somebody held my table once, okay, next time you ask me to climb the table, I will do it without the help. Can you understand? So when you give me a task, I have to sense the height. Okay, and then when I climb on it, I should know how I should keep my hand so that I don't fall down. So how do I do this? Because from my past memory, I saw somebody doing the same thing, or I got the feeling and I did it immediately. Okay, so this networking, okay, is very slow or not well connected in children with ADHD or autism. Okay, so you have to make their network richer. You have to give them more and more experiences where they continuously keep on, and the circuit becomes very well connected. Okay, so you have something called synapse. Have you heard about synapse? Anybody knows what a synapse is? A synapse is the space between two neurons. Okay, your nerve is containing different neuron pieces called neurons, and information goes from one neuron to the other through a space called synapse. Okay, and in that space, the signal goes like as a chemical. Okay, so the electrical signal has to get converted to chemical signal, then chemical signal has to get converted to electrical signal. That's how it jumps from neuron to neuron. For this process to happen smoothly, it has to happen again and again and again. And that, say for example, I'm pouring a glass of water, okay, in a very clean floor. Okay, how it is going to travel, I don't know. Can you understand? But I'm wiping it. Okay, and then again I'm pouring water on that same floor. What will happen? Huh? You're pouring water on a floor. Okay, it's going like this. Okay, then I'm wiping it. Then again I'm pouring water. What will happen? Huh? It will go in the same way. Okay, you have wiped it, no, the same way, because the particles are aligned and it will, the pathway is created and it will go the same way. So similarly, if information, I throw a ball to you and you catch it, I throw a ball, so this is practice makes man perfect. Okay, so I keep on getting that signal visually and then I'm responding with my motor response. So this happens continuously. Okay, then you're giving me two challenges. You're throwing it this left, left, right. Okay, then you're saying I'm going to change the pattern. I can do left, left, right. I can do left, right. Okay, but now since I have done it so many times, left, left also I can catch. Can you understand? That's how you train your mind to respond. Okay, so similarly, you have to train the child to respond to balance. That way, if the child has a lot of experiences, the network will get connected. Any input the child can manage, knows how to respond. So that much experience of movement and balance you should give the child. Then the child will sit and listen to you. Okay, so if a child is not sitting and listening, okay, we cannot just scold the child and make the child sit. Okay, we have to, one, use ABA techniques, task analysis, make the task smaller, okay, achievable. Once the child has achieved it, reinforce it. Okay, make the child feel good. And then another part of it is sensorily you have to network the child's brain. So this is for inattention. Okay, next we are going to the next thing called hyperactivity. Hyperactivity is mostly a result of inattention. The child needs the movement, needs the experience. You have to understand that our brain is just like what sir told, AI. Okay, AI is artificial intelligence. Okay, our brain is automatic intelligence. Okay, that is, we already have a scheme. We already have something called a schema in our brain. Okay, our brain, even if you do not have a parent, even if you do not have a teacher, it will keep on learning and moving on to the next experience. Okay, so nobody teaches us how to fall in love, how to be a good mother, how to be a good wife. Nobody teaches us. We just move from one stage of our life to the other. Can you understand? So just like that, children will move from one stage to the other according to the need of that particular age. Okay. So the first stage is the stage where we need food. Okay. We need to sustain life and we have to grow. Okay. So for that, for nutrition, the child will pick up things and put the things into the mouth. Okay. So that is a age where the child will pick up things and put the things into the mouth. That's a age. So at that age, you can't keep on pulling the things from the hand and throwing. Okay. You have to make sure the child gets enough to pick up and put. If the parent is going to be feeding, the child is, that satisfaction is not going to be there. Child has to eat with their own hands. That way they get sensorily satisfied. The network gets satisfied that, yes, I have learned the skill, move on to the next skill. So the next skill is exploration. The child has to explore the world. Only then they can respond appropriately. So they start walking around. They start picking up all the heavy things, trying to carry it. Okay, they put from here to there. Okay, they want to take everything, drag everything. Okay, they want to push and see. They want to throw and see how far is it going. Okay, I'm throwing something. Is it disappearing? It's called object permanence. Is it there or it's gone? Peekaboo. Okay, I'm hiding something and taking it out. Can you understand? So this is the schema of the brain. So in that explorative stage, you have to take the cue of the child and give the child more experience in what the child is connecting. The child is opening all the doors and seeing. Okay, then you give activities like that where the child can open all the boxes and you have some certain things in each box. Okay, all your tiffin boxes in the house, you collect and put it in a carton and give it to the child. Let the child open each box. Inside each box, you can put some toy and keep. So child will be reinforced. Okay, so child gets satisfied. So you watch the child's curiosity. That is the schema, the development that is happening at that age. So hyperactive children. Hyperactivity is a word which you can use after doing this assessment and giving it to your parent. But lot of parents today call typical children hyperactive. Correct? Hyperactive. Okay. So that is not hyperactivity. Okay. Children are just curious. Okay. So to make the difference in this questionnaire, just look through it. Okay. From 10 to 18. If again the score is 6 or above, you get hyperactivity. So, and combination of this, okay, from the first question to 18 question, if you're getting a score of more than 12, then it is a combined type. Okay. So next we are going, I'm not going to go into oppositional defiant disorder and anxiety. It's there in the paper. Just take a look at it. If you have older children and you want to diagnose anxiety or depression, you can use this, after which you can confirm with a psychologist. Okay. So this is the second tool. Okay. Generally, I hope all of you know the features of autism. Okay. So this is the third tool. This is called MChat. Okay. MChat again is available online, free of cost. Okay. MChat is for autism screening. Okay. So if you want to check out if your child is having features of autism, this is a 20 question format in which you have certain questions which have to say yes, certain questions you have to, the answer has to be no. Okay. So in the items that is 2, 5 and 12, the response no is a bad answer. It is indicating autism. Okay. So I'm just going to read out to you 2, 5 and 12. Question number 2 is, have you ever wondered if your child might be deaf? Okay. If they say yes for this, that means you're getting a score for towards autism. You're giving 1 mark towards autism. Okay. Then the 5th question, does your child make unusual finger movements near his eyes or ears? Okay. Yes means again, this is towards autism. Okay. And 12, does your child get upset by everyday noises? For example, when another child cries, or a vacuum cleaner, or a mixie. You understand? For these 3 questions, if it is yes, then it's more towards autism. You're giving a 1 mark towards autism. Okay. Other questions have to be no, to be towards autism. So I'll just read an example. If you point at something across the room, does your child look at it? Okay. For this, there should be a yes. If it is yes, now your child is normal, no na more towards autism. Understood? So you read through these 20 questions. Okay, and then you categorize them after that. This is a very quick tool. Okay, you can just use it in 5 minutes. Okay, if it is less than 3, means you don't have to worry. Your child does not show features of autism. 3 to 7, within 2 to 3 weeks, okay, or at least 3 months, ask them to sit with the child, interact with the child, remove television and videos, okay, and then bring back the child in 3 months and do the test again. Okay, autism, I want you to know something about it. Okay, so as a takeaway today, I would like you to know, okay, this is about autism. Autism is not a developmental delay. Okay, autism is very difficult to convince because it is not a developmental delay, it is a developmental regression. Okay, so as pediatricians, we will be following the child every month when they come for vaccination, and everything will go on smoothly. Okay, 18 months, okay, around 18 months, any child can start showing signs of autism. A child which has been normal until 18 months has shown every milestone and has been interactive, has been talking and already said amma appa, suddenly loses the words, suddenly starts going backward. And very unfortunately, we don't know the reason, right? So immediately what we do, I gave MMR vaccine. I gave MMR vaccine, or I gave, my child had fever, or mother went to work. Okay, கரெக்டா அப்பதான் எல்லாமே யூஸ்வலா நடக்கும் இல்லையா? 18 months வரைக்கும் 1.5 years வரைக்கும் இருப்பாங்க வீட்டுல, ஒர்க் போக ஆரம்பிப்பாங்க, இல்ல டிரான்ஸ்ஃபர், ஓகே, இல்ல கோவிட். ஓகே, இதெல்லாம் நடக்கும் கரெக்டா 18 monthsல தான் மோஸ்ட் காமன்லி மதர்ஸ் வில் ஸ்டாப் பிரஸ்ட் ஃபீடிங், they will go to work, okay, or they will give MMR vaccine. Immediately what will happen, within 2 to 3 months when the child is regressing, they will think that is the cause. Okay, and when the mother starts going to work, television will increase, videos watching will increase. Okay, and immediately it is correlated to that. Okay, so our recommendation now is at 18 months, 2 years and 3 years, do the MChat scoring for everybody, because a child who passes MChat at 18 months can become positive for autism in 2 years. A child who has passed 2 years can have autism diagnosed at 3 years. You understand? So until third birthday, we cannot say for sure, but any child is not having autism. Okay, any child can have autism. Okay, so what about the role, why this is happening? Okay, because autism is something that is caused because of poor networking. Okay, your sensory organs are not connecting with your central processing unit, and the child is not responding. Okay, so it happens up to 18 months because your needs are very less. Okay, and your inputs are also very less, so the child slowly starts connecting, gaining milestones, everything. But around 18 months, there are a lot of roads are opening in the brain. Child starts observing a lot, and that's where the jam happens. Child gets confused. Okay, there's overwhelming information, child cannot process it, and child will start withdrawing. Okay, and unfortunately, the biggest supplier of information is, who's the biggest supplier of information? Who's giving us a lot of information? Huh? Google. Correct? All our grandparents are sitting at home today and they have more information than what happened today in Bangkok. Huh? Correct? Because of the videos and the television. Okay, so if I'm going to tell a story, okay, if I'm going to tell you a story, okay, you can process only my audio. Okay, I'm not going to give you much of a visual. Okay, you'll just process my audio. Okay, and you're capable of just processing my audio. Correct? I processed my grandmother's stories. Okay, I know all those stories until today. Correct? I haven't forgotten Ramayana, Mahabharata. Correct? I just got the audio, I did not get the video. Okay, but when it comes with audio, video, color, sound, okay, everything, there's too much information to process, so the brain gets totally overwhelmed, the network, all the processing activates the child gets jammed. Okay, child starts regressing. So today we use a very common term called virtual autism, but it doesn't happen to everyone. Okay, everybody is watching TV. They are not. They are all doing well. Okay, yes, all of us come with a genetic code. Okay, we don't know who's having that particular gene. Okay, so that's why everybody should not watch television or videos at least up to third birthday until we are sure that this particular child does not have autism. Okay, so this much I hope if you take home, it will be good enough. In the same tools, I've also given learning disability. Okay, that is also just a checklist. One thing I'd like to tell you, one more point, a very common today, something that I'm very what to say, I'm also, it's very new to me also. There's another term called hyperlexia or Asperger's. Okay, this is nothing but autistic children. Okay, a variation of autism where the children are having trouble with connecting with human beings. Okay, their language delay is there. Okay, and doing any skills or milestones are being delayed, but they are able to connect very well with alphabets and numbers. They are reading beyond their age. Very easily, they are reading the board, everything they are reading. Okay, so UKG child is reading a full passage. Okay, this is very common today. Okay, because their network is in chunks. They are understanding things in chunks rather than phonetically. And there's something called gestalt language where they are learning in chunks. They can tell a whole dialogue, but they cannot tell what did you eat today morning? Idli. They can't tell that. But come on, let's go home. They can say that. Okay, so there are certain learners who are learning differently. Okay, they are in that is called hyperlexia and Asperger's. Okay, so they are high functioning autistic children. So for them, we cannot go phonetics, alphabets, words, passages. We can't go like that. We have to go straight away to sentences. Okay, and then divide the sentence into words. I tell a whole sentence, child understands that, then I start telling, say for example, come on children, let's go. Okay, every time we go out, and then child has started obeying and saying those things, then you say, come on children, let's go. You divide it into three. Okay, then you say, come on children, let us go. Okay, make it into 4 pieces. Can you understand? So that way these children will learn better. Okay, so please read up more on that. For classroom modification, okay, if you have an ADHD child, make the space a little smaller so the child can focus, get them into smaller groups. Okay, you can make the child sit next to you. Okay, and make a separate place where they can sit down and take their tests. You can give them an assistance. Okay, like what ma'am told, when somebody is playing in the sand pit and you know that the child gets triggered when another child comes next to the child, you get prepared for it. Go and sit next to that child and start engaging the child in other behavior, or tell the child, see that child is also coming, he's going to play here. Okay, so you have one toy, you have one toy. So start. So you have to be proactive for children with ADHD with autism. Okay, and make the question paper according to their level. Give them different question papers, make it smaller, make the boxes bigger so that they can write it easier. Okay, and reward and give them breaks, give them sensory breaks. Okay, any questions? So 3 tools I have explained to you: ages and stages, MChat and Vanderbilt. These are all freely available. Okay, and learning disability tool also I shared with you. Anything else you want to know? So we'll close. I'm the last speaker, so I want to. Okay. Done? Okay. Okay.
Thank you so much for the practical session, ma'am. You've discussed about how developmental disorders can impact in their learning and how it can create a barrier to update themselves when it comes to a learning procedure. And you have showed us many practical tools to discuss where is their practical, where is the liability lies. So thank you for the practical session, ma'am. Now I request our students to felicitate our guest. what do we do? Thank you, ma'am. All the tools that you have shared so far, hope it will create a big impact for the teachers and the new learners as well.